Pulse Polio Program. It is an immunization campaign which was established by the government of India to eliminate poliomyelitis in India by vaccinating the children under the age of 5 years against the polio virus. The basic aim of this program was to enhance the polio immunization for the groups who were not able to mobilize, and therefore the campaign was made such that it mobilized from place to place to immunize the childrens. Now, pulse polio program, the 2 drops of polio vaccines are being given to the child, and other than that, in the national immunization schedule also, the oral polio vaccine is given to the child at the time of birth, and then at the 6 weeks, 10 weeks, and then at the time of 14 weeks of birth. After birth, the children is being given the oral polio vaccine. Now, other than that, the IPV, injectable polio vaccine, has also been introduced in the national immunization schedule, which is given on 6th week and also on 14th week. Now, coming on to the exclusive breastfeeding. Exclusive breastfeeding, actually, breastfeeding is a way of providing the ideal food to the child for healthy growth and development of the infants. And breastfeeding is also an integral part of process, reproductive process, which help the implication for health of the mother. Now, and basically, exclusive breastfeeding means that only the mother's milk has to be given to the child, and up to the time of 6 months of the age. And complementary, in case of complementary breastfeeding, up to 2 year of age, the children should be given breast milk. Along with that, other food also can also be given. Now, initiation of the breastfeed in the first year of the life, within the first hour of the life, is very much important for proper growth of the child and also for the proper development of the mother's reproductive system also. Now, coming on to the proctoscopy. Proctoscopy is basically a type of procedure in which we insert the proctoscope to visualize the anus and rectum of the patient, and also to take the biopsy from those sites. So, like in case of the and rectal carcinoma, and proctoscope basically has various parts in attached to it, and one of them is a light which is attached to the distal end of the proctoscope, so that we can visualize the internal organs properly, and properly visualize and take the biopsy from that only. And basically, proctoscope is of around 13 centimeter in length. And now, coming on to the um, atrial fibrillation ECG changes. Basically, atrial fibrillation is a type of the uh, impulse which is very high, generated from the heart, there, which leads to from the pulmonary veins, which leads to very high heartbeat of around 300 to 400 beats per minute. Now, atrial fibrillation can be detected on the ECG, as the QRS complex is very irregular, and QRS complex is very regular, and RR interval are also irregular in case of atrial fibrillation. Therefore, AFib can be can is also called as that it is the next step of atrial tachycardia. Means after atrial tachycardia, we can see that AFib can occur in the patient. Therefore, we have to control the patient's heart rate by giving beta blockers and all the necessary drugs which are important for managing. Now, the difference between isolation and quarantine. Isolation is basically done for those patients who have who are infected by COVID, means who are positive on testing, and as well as who are sick. While quarantine is done for those patients who are contagious, means those who have came in contact with the person who are infected. And second difference between isolation and quarantine is basically that the isolation is done minimum for a period of 14 days, while quarantine, the upper limit of doing the quarantine is 14 days, but it is not always necessary for putting the person who was in contact for 14 days. It can be for less time also, until the patient we can until the we feel that the patient is now normal to go out. So these are basically two difference between isolation and quarantine. Now coming on to the heart sounds, there are various type of heart sound. First of all, when comes to the normal heart sounds, it is S1 and S2. S1 and S2 basically are those heart sound which come on the closure of the atrioventricular and semilunar walls respectively. Now coming on to the S3. S3 heart sound is basically heard when there is an increased atrial pressure due to the increased flow rate of the blood in the heart. Now S4 is also considered basically an abnormal heart sound because it basically is an indication of the diastolic heart failure, which occurs generally due to the left ventricular hypertrophy. Now another different type of the abnormal heart sounds are murmurs, like systolic murmur, which basically occur while contraction of the heart, diastolic murmur, which occurs during the relaxation of the heart, and continuous murmur, which occurs completely throughout the cardiac cycles. So these are basically types of the abnormal heart sounds.
Thank you.